Some health officials are sounding the alarm after SickKids Hospital announced they'd be shutting down a national helpline. Mother Risk offered advice not just to patients but also to health service providers about the risks associated with certain drugs to pregnant and breastfeeding mothers. Now, many are concerned that losing access to this vital information could have a devastating impact on our health system.
When I was pregnant in 2016, I was getting some dental work done and was a little bit concerned about the antibiotics that were required afterward. So my dental assistant actually gave me the number for Mother Risk.
That's how Blair Richardson first became familiar with a SickKids helpline that researches the impacts of drugs and other exposures to expectant and nursing mothers. But soon the service became a lifeline for the anxious mom who'd already lost a baby before the birth of her daughter.
Every little noise, every little, is she breathing funny? It gets you worried. I've had a history of loss, so I just wanted to make sure that everything was normal, and it was a real comfort to say, you know, maybe it's not emergency worthy.
The reassurance part was huge with a service like this, and it saved millions in just costs, healthcare costs, and unnecessary ER visits.
But the service wasn't just a tool for first-time moms. The research hub was the only one of its kind in Canada. Funded by grants and private donations, it offered scientific, evidence-based information to healthcare professionals so they could advise their pregnant and breastfeeding patients.
It could be chemicals at work that you're dealing with, or it could be simply the supplement and the dosage of a supplement that you're taking. It could be radiation. Women who have anxiety, depression, OCD, they're on a number of different medications, and they're extremely anxious about taking and continuing treatment while pregnant and breastfeeding.
Neda Ibrahimi worked as a research assistant and counselor for Mother Risk, taking calls from across the country for nearly a decade. She says about 20% of their callers were those working in the medical field. But now, after 35 years, the research program is being shut down. In a statement, SickKids interim CEO says it was not an easy decision given that call volume to the line has remained high. But, quote, without sustainable, secure funding and absent an alternative, reputable organization to host and fund the helplines, SickKids has made the difficult decision to close the program. Ibrahimi is extremely concerned about the potential impact on mothers and their babies.
Their healthcare providers are not able to answer their questions, especially when it comes to newer drugs and medications. So what will happen is that Dr. Google, mother-in-laws, forums are going to be the go-tos. And there will be a lot of misinformation.
In his statement, SickKids interim CEO admits one of the reasons private funding has been difficult to secure is because of negative publicity to the Mother Risk brand, following the closure of a lab that shared its name. An independent report in 2015 found that drug and alcohol hair tests they'd performed were unreliable, the revelation impacting more than 1,000 child services cases. SickKids has opted not to rebrand the program under a new name, adding the program needs to be reinvented, set up with a clear national mandate, and tied more closely to the obstetrics and primary care communities. Physicians and scientists on our staff would be very happy to work with any new host organizations. Ibrahimi says she hopes that can happen this time with governmental support.
It's important that it's mandated and supported by both federal and provincial funds, as well as private public donors and anyone who's an advocate for maternal and infant health.
Now, Ibrahimi is one of the hundreds of clinicians who have signed a petition to help get the program back up and running. SickKids, though, is now directing users to a U.S.-based organization called Mother to Baby, which offers similar information. But even its CEO has expressed concerns about their ability to take on hundreds of new calls a day.